My name is Chris Gibson. I am the Paramedic Program Director and Professor for the Paramedic class. It's about an 11.5-month program, so we kind of go from start to finish, fall to summer the following year.
For Paramedic class, our first day was kind of like an orientation day, and by the second day, Chris had us start in IVs and learn how to do that. And pretty much we hit the ground running right away, and it hasn't slowed down since.
Throughout the whole process, we begin to learn some advanced life-saving skills, some advanced algorithms. We have several medications we learn. We also give the student the ability to have hands-on internships, so they ride on an ambulance for the whole duration of the program. They also do in-hospital internships where they get to put some of the skills to practice in the settings such as the ER.
I've learned a lot of things over the last several months. A lot of different ways to assess traumas, a lot of ways to start IVs, do blood draws, deal with stroke patients, a lot of cardiac arrest events, breathing events. Just we get a ton of skills.
I feel that we're just beginning to really become up and coming. We just recently acquired an ambulance simulator, so some of the equipment that we train with is really kind of new, cutting edge technology. So having an ability to train and actually have the feel of working in the back of the ambulance and simulate patient care.
We do have an ambulance simulator. That's really cool because we have it set up how we wanted to set up the back of the ambulance, what the students were most comfortable with. We know where everything's at. We can go through live calls. That way when we go to the clinical setting, we're ready for what's thrown at us.
Our simulation lab is also growing. I also feel that we're starting to incorporate new virtual simulations, so that's going to be something in the near future.
We have a new sim lab. His name's Apollo, and he can really mimic a live event really well. And with Apollo, we've done a lot of things, like we've ran through full arrests. We can intubate on him, and once you intubate on him, if it's successful, he will actually mimic what a live intubation would be. So his O2 saturations and all that, they'll rise as your success rate goes up.
The demand for paramedic graduates is very high. They're always looking and hiring. So there's a lot of opportunities, a lot of different avenues you can take your paramedic and apply to the job setting.
So I hope to graduate my associates in paramedics and then go to the fire academy for 8 weeks after this. And I hope to work as firefighter paramedic for at least the next 20 years, well farm.
I believe that we have the technology here to make sure that you're able to be job-ready paramedics once you graduate. The people in the clinical setting are willing to help out however needed, so they're providing a lot of invaluable real-world skills, some soft skills that you really can't learn in a book. And I feel that we do a good job working together as a team to produce fine quality paramedics.